Good morning, you guys. It is time for your health check and an update for you today on COVID-19 variants. Okay, now there are a lot of reasons we need to talk about this. Number one, because variants are showing up in our country and here in North Texas. Number two, because a lot of you are excited about summer travel, which I get, but depending on where you go and depending on whether or not you're vaccinated, you really do need to know what you're up against. Which brings me to point number three. In the last week or two, the European Union has said, look, we're opening up to vaccinated Americans. A lot of countries you're hearing about are doing this now, which sounds really positive and exciting. So let's break this down. Here's Dr. McCoy from the Association of American Medical Colleges on the science behind variants.
We really need to decrease the virus in the community. Viruses mutate. The more virus that's out there, the more it's going to mutate. So that's just what viruses do. This is nothing truly unusual so that variants are showing up. But the best way to fight variants is to really have people vaccinated.
Now, this brings me to a really excellent point. Listen up. If you're vaccinated and you want to travel, where can you go? Well, the CDC has a travel notices page with a list of world destinations. They offer guidance based on COVID prevalence, circulation in those countries, but also vaccine coverage and performance in these places. And they assign a level, level 1, 2, 3, 4. I checked all 27 EU nations for you guys. All of them are considered level 4, which translates to very high levels of COVID. So they are asking, the CDC is asking travelers to avoid these areas. By the way, it's not like that everywhere in the world. You can see the map is shaded in different colors there. But I know some of y'all are going to do what you want to do. So I asked Dr. McCoy how vaccines are even stacking up against these variants. For those of us who are fully vaccinated, here's what she had to say.
If for some reason there's some signal that there's some variant that the vaccine isn't working, vaccines aren't working well in, then that would be of more concern. So far, we have not seen that. I think that would probably be something that would cause us to be concerned. I mean, I think the companies are also looking at all the variants, the vaccine companies, and thinking about how, if they do end up doing a booster, how they address the variants.
Okay. Takeaways here, you still need to be cautious. Yes, vaccines are working. Numbers of infections, hospitalizations, and deaths across the board are down, but stay smart, okay? Masks, a little physical distancing, good hygiene, and remember, we're still in the middle of a pandemic without really knowing how long protection from these vaccines will last. That is still being studied. So, of course, Mark, I just got my second shot last Friday, so I hope that the protection from that shot lingers for a very long time.
Yes, we all have our fingers tightly crossed, along with the news about kids being able to potentially get vaccinated soon as well. Hopefully changes are headed our way.